The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit viconsupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. I have Dr. Jeffrey Gross here today. He graduated from the University of California, Berkeley, with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 1992 from the George Washington University School of Medicine. He contributed to virology research during his studies. After graduating, he undertook a residency in neurological surgery at the University of California, Irvine Medical Center until about 1997. He then pursued a fellowship in spinal biomechanics at the University of New Mexico until 1999. Licensed in California and Nevada, Dr. Gross has spine practices in Orange County and Henderson, Nevada. A trained neurological surgeon, he specializes in athletic injuries and spine procedures and offers, are you ready? Longevity and biohacking consultations. So we're going to dive into longevity today, by the way. He's certified by the American Board of Neurological Surgery and is a member of several prestigious surgical societies. Since 2020, Top Doctor recognized Dr. Gross as a leading neurological surgeon. He also received Health Tab's 2022 Top Doctor Award as the top neurological surgeon in the United States. Dr. Gross founded now capitalize this, Cell, C-E-L-L, Abrate, focusing on anti-aging and regenerative medicine. The mission for Recelebrate emphasizes offering modern biochemical treatments and considering surgery as a last resort. Welcome to the show.
Wow, thank you.
Do you always hear your bio and go, is that really me?
No, in part. The other part's like, oh, that's an old one. So many updates I need to do.
Oh my gosh. Oh my gosh. Well, you can give us those now, because what I always love to dive into the background, right? There's a reason you got here. There's more work that you're doing, super exciting things. Tell us all about it before we dive into longevity and biohacking.
Totally. I'm going to go quickly with this because we should not waste time on me, because what we are going to talk about is for you, the listener. Yep. But I was, as you said, I was practicing spinal surgery, neurosurgery. I was always non-surgical. I was the last option anyway, at a very low surgical practice. We did everything else we could. And my patients would come to me in that gap. That gap is they've tried everything, therapies, anti-inflammatory lifestyle, exercise, strengthening, weight loss, injections, and they might have helped some, but they still had issues, but they weren't ready for surgery, which was the next thing on the institutional menu. I say the sick care system menu. That's what's next. Yep. That's what you hear about. And they were frustrated. The doc, what about lasers? What about crystals? What if I, seek Buddhist, monastery for 3 years? Will I get better? And enough people said, what about stem cells to me? And chance favors the prepared mind. And my undergraduate background is in molecular biology, the field of stem cells. Yep. And I finally, you get hit on the head with a rubber mallet so many times, you go, okay, this is silly. I'm going to stop going to these annual spine neurosurgery meetings where the same bow tie wearing knuckleheads are saying the same thing decade after decade. I'm going to go to a stem cell conference and see what's happened since I went to undergraduate school. Yep. So I did, and boom, I was reawakened. I put down the Kool-Aid, the sick care system Kool-Aid, And I started relearning, re-educating to add that tool to my spine practice. However, it became everything I do now. Spine is just a portion of what I do. We treat joints, we treat systemic inflammatory problems, we help address so many things with stem cells, stem cell signaling through stem cell exosomes, peptides, growth factors. Especially the last year or two, peptides have just blossomed.
Exploded.
So
Yeah.
everything we do is attuned to improving cellular health, reducing inflammatory aging damage at the cellular level to help the person. So that slows the aging process is a byproduct of that.
Yeah, absolutely. Absolutely. All right. So can we talk about, I want to dive into exosomes. I want to dive into, but can we talk about what do most people overlook? I think sometimes we're maybe looking so hard at how do I age healthy? How do I increase my health span, longevity, function better? What do I do? But I feel like that's something that's overlooked. What do you think that some of those things are?
Yeah, it's the basics. It's the stuff you grew up with and your grandmother told you about, eating clean, eating healthy, sleeping right. That doesn't mean just the hours. It means quality restorative sleep, exercise, and what, especially here in the States, people sit on the couch and get fat and eat processed preserved foods and watch Netflix until 1 a.m. And they are doing everything they shouldn't be.
Right.
That's not to say you shouldn't enjoy some quality time enjoying a show or whatever, but respect circadian rhythms, respect the earth and what it gives us for food, and not the chemicals we put in it. Avoid electromagnetic fields to the extent you can; they're everywhere. That kind of thing. So, and that's the short list.
Yeah. Yeah. Can you, so let's stop here for 1 second because I'm interested. I know I have my sleep hygiene habits. What are kind of the top 5 sleep hygiene habits that you would say are the ones that you suggest more often than not?
You gotta have a ritual at bedtime so you can get into parasympathetic mode, stimulate your vagus nerves. Breathing is 10 really deep breaths, yoga breaths. Put down your screens. The eyes need darkness, so maybe where you wear blue blockers at night or something, so that helps. Don't stay up too late. Sleep in a cold room with the covers all pulled up, snugged up, right? So your face should be cold. Comfortable setting. You can consider an electromagnetic grounding mattress pad if you want to pull some of those negative ions off of you. And then you should learn to use data to track your sleep. I use a particular app on my phone. I put my phone away from my body on the nightstand as far away as I can, but it listens to me sleep and it tells me, how the breathing, how deep was my sleep, what have you. You learn how to get more quality sleep by learning the different pieces that go into that. When was your last caffeine? I know I can't have caffeine after 3 p.m. or I'll have trouble sleeping.
Yep.
Are you taking the right things to help your body repair at night? You'll sleep better, like melatonin, magnesium, some of the nighttime, pills that I'll take. And even if you go to sleep fine, you're like, I don't need melatonin. Melatonin is a hormone that helps you repair cells, and it's an antioxidant, and it helps you sleep deeper and have these wild dreams, which is a sign of deeper sleep. So those are the kind of things I don't know if I listed 5, but I may have worked outside your rules. Sorry, I broke the rules.
No, it's all right. That's what we're here for. Those were great, and I agree with all of them, melatonin included. I know sometimes melatonin gets a bad name. People are like, "Well, then my body won't produce it." It's like, well, but that's the
point. Your body's not producing it. You got to take some.
Exactly, you've got to take some, right? Okay, so let's talk about inflammation and oxidative stress, because we know that inflammation accelerates aging, right? We also know it accelerates the onset of potential chronic disease, right? It is the driver behind that. Let's talk about that.
Right. Yeah. So let's group those together, because chronic diseases are inflammatory diseases and vice versa. And those are what age us.
Yeah.
And aging is an accumulation of this chronic inflammatory state. Those all go together in my mind. The more aged your cells are, the more degenerated they are internally, the more at risk you are for a disease related thereto. Yep. So anything you can do to slow that process and reverse that process will slow disease progression or formation, prevent, and therefore the aging process. And that's why you can look at two 80-year-olds and one looks youthful, has good muscle tone, muscle mass, is energetic, sharp mentally, and another is ready for a nursing home. Right. And those two people are the same age, but one has a different biological or physiological cellular age, and that can be measured. We have tests for that now.
Yep. Yeah, amazing. And let's talk about the field, like, right, that regenerative medicine field, because I feel like right now, just even given what you're doing, you're really biohacking into health and longevity by doing some of these practices, right?
Yeah.
Let's dive into that a little bit.
Yeah, and I kind of like the word biohacking. Some people don't like it. It sounds like you're tricking your system. Heck yeah, we are. Trick it all day long. Yeah, exactly. Trick it all day long. Exactly. Yeah, so I do agree that regenerative medicine, the field, means to take advantage of some knowledge we have about how a baby is made and how that's a highly anti-inflammatory process, and that growth, development after you're born, growth and development, healing, which we do really well as a young person, not as well as an old person, represent a certain change from a very anti-inflamed set of cellular activities to an inflamed set of cellular activities. And those anti-inflamed, even though we use the word inflammation generally here, there are many pathways at the cellular level, biochemically, right, that deal with inflammation. And when we're young or we're being created in the womb, we're the opposite. We're anti-inflamed. And that's optimal functioning mode. That's like factory reset. Everything's working great. You know, there's a role for acute inflammation. You know, if you're a kid and you get a, scrape your knee or something, it hurts, it heals. Mom cleans it up, puts a Bactine and a Band-Aid on it, kisses you and sends you on your way. And 3 days later in the bathtub, that Band-Aid falls off and your scab's almost completely healed. If you're 75 and you bang yourself, you've got a bruise for a month. So that you're the same person, the same genes. It's just that your cells are so gunked up with stuff and inflamed, they can't behave as they used to. So regenerative medicine is hacking or encouraging your cells to go function like they did when you were younger. And how do we do that? We use young cell signals. So whether they're stem cells, exosomes, peptides, growth factors, all of these are in this umbrella of biologics that are used to encourage your cells to behave that way, the youthful, restorative way.
Yeah. So let's dive into a few of those different communicators. So I love peptides. I discovered peptides probably 4 or 5 years ago now.
Yeah.
And so I use them regularly and I love them. There's many that I kind of lean on, but give me some of your favorites based on just how they work or why you would use them in the first place from that perspective, from that anti-aging kind of cellular communication perspective.
Right. You told me I couldn't have 2.5 hours for this show, but I'll do my best.
You're like, oh my gosh, I could talk about this all day long. Right?
Yeah, I could, and I do. But so I still do a lot of musculoskeletal work since I'm a spine neurosurgeon. I see a lot of spine problems, a lot of joint problems. I do regenerative injections to help restore cartilage. We pair that with musculoskeletal recovery peptides like the body protection compound 157, BPC 157, TB 500, together the base of what we call the Wolverine protocol. We pair that with KPV and another anti-inflammatory peptide to put those cells in healing mode, also great for neuroinflammation for the brain. We use the copper peptide, not just great for skin and hair, also great internally. So that close stack, those 4 I use quite a bit. We use Cartilax to help build cartilage. If people need more muscle mass as part of a recovery and a longevity program, we might have them on ipamorelin, tesamorelin, CJC 1295 with DAC. We might be using others in that growth hormone support category, growth hormone secreting category. We use a lot of retatrutide a GLP medicine to help with fat loss. I used to call that weight loss, but it's really fat loss because we don't want to lose muscle, and reduction of inflammation. I've been on a low dose for years of that. We like to use other peptides strategically. I mean, I could list many ones for the brain. We like nootropic peptides, CLAC, CMAX, the KPV, dihexa. For the gut, we go back to the BPC 157. We have others that might be used to help suppress cancer, PNC 2728. We have some other ones we're trying to source to fight inflammation, ACL 26, I think it's called. For libido, we have PT 141. I mean, tell me when to stop.
You're covering on. I'm like, yep, heard that one. Yeah, heard that one.
Yep.
Yeah, I've heard that one. Like, yes.
Yeah, and that's the low-hanging fruit list. We have many others, Clotho, FOXO4 DRI, again, in the cancer, the longevity group, the bioregulators like Pitel-Killah. We might do the mitochondrial peptides for repair, SS31 for a month, MOTC for a month. And then, there are others, humanin-like peptides as well. Most of them are naturally occurring. Every now and then, one of them has a slight change in it to get even more activity. But these are biologics.
Yeah. And I find they make a huge difference.
I do too.
Yes.
I do too, personally and professionally. So I agree.
Yes. Well, and I'll give you my favorite, and it's just near and dear to my heart because it really changed my health years ago, is Vasugen. So when I discovered Vasugen and I used that to open up blood vessels, right? It just helps circulation. When I had mold exposure, that was a game changer for me, along with some other options that I was using. So I definitely have a soft spot for that one.
Yep. We could go deep dive, but they are incredible cell signals that we pair with when we do regenerative things, or we do them by themselves, or what have, depending on the patient.
Yeah. Well, and there's different delivery systems too. I feel like some people get hung up on peptides being injectable. I am partial to the injections, right?
Yes.
I do that for myself, but there's oral peptides out there. I'm actually using a Pitel-Killah right now, and it's an under the tongue spray that I'm trying from Profound Health. So there's so many different options as well. If you,
Yeah, we looked at the bioavailability of these, and in subcutaneous injection by far is the most bioavailable way to get peptides. I have tried some of the oral strips and things. You have to take multiple strips to get a similar amount of peptide in your system. The nasal sprays for brain delivery seem to be very good. Not as good as injection, but very good. And like you said, you've got an oral spray. Some people do oxytocin by nasal spray or oral spray. So there are options, but for those out there who are afraid of a needle, the subcutaneous injection is no big deal.
It's not. Okay, so can I interject with a funny story? I think you'll enjoy this. I am the type of person when I grew up. So one of the funniest times was I took my dog to the vet and he got a vaccine. And I took him out to pay. Standing at the counter, and I passed out. I'm that person, right? So the very first time I decided to use peptides, I met with a peptide expert, right? And I met with her and I said, okay, these are what I want to use. I have them. Okay, now show me how to use them. She's like, oh, it's easy. Just do this. I'm like, oh, you're not going to walk me through it? She goes, no, you're fine. So I'm like, okay. I thought, well, let's be safe about this. If I do pass out, I'm just going to lay down on the bed and I'm going to give myself the needle there, because if I pass out, I'm already laying down, right? Yeah. And I was totally fine. So for someone who has that aversion to needles that can actually now do it on their own, you can.
You overcome. Look at you. The obstacle is behind you. I love it. Yeah.
Oh my gosh.
Well, you're in Canada, right? And you got peptides in Canada. I know it's a challenge in many places. Yep.
Yes. And it's going to become more and more challenging, I think, to be honest.
And I see it being less challenging here in the States. So, but as long as you work through a clinician, you can get it. So the oddity here is many Americans buy their medications to save money from Canada, and Canadians buy their peptides from Americans. So at least we're reaching across the border.
Exactly.
Look at that diplomatically.
Yep, for sure. Okay, so let's dive down into exosomes.
Yes.
Let's talk about why you potentially think they're the central to the future of cellular communication, the little postmen.
Oh, they're not the future. They're the past and the present and the future.
Okay.
So we know that cells communicate with each other in our body. And if you introduce other biologics from someone else into your body, that's how they communicate. So like if I had a cell, it might go up and bump up against your cell, and they might share information. But the real more significant cell availability, really communicating, happens through small molecules like peptides / growth factors, and by exosomes, which are an outbubbling of a cell. For those of you who don't know what an exosome is, cells give off a little bubbles of themselves, and that's through a process you might have learned through your high school biology called exocytosis. Remember that? I'm giving people flashbacks and PTSD. Sorry.
They're all going, no, I tried to forget about that fact.
Yeah. So a little bubble, and that bubble contains contents, and that contents came from the cell.
Yep.
And that contents is taken in by a neighbor cell that's receiving that communication. And that's through endocytosis. So it brings in that bubble and delivers its material. And that material is also peptides, growth factors, small molecules, microRNAs, and some lipids and some. It's giving you a piece of themselves so that it can tell you what's going on. So it's a neighborhood watch. Hey, we're under attack by an infection. Get ready. Protect yourself. Or, hey, everything is great. Chill out and don't be inflamed. So when you get a biological signal from stem cells, you're getting a stem cell derived exosome. So all cells make exosomes, but when we use that phrase generically, it's typically a stem cell derived exosome. And why do we like exosomes? Because they do the work of stem cells. Stem cells don't do their own work. They actually deliver exosomes. So when you get stem cell, if you're going down to Panama because you heard it was great to go down there and get a vacation, it's great. You can do that. What you're really getting in those stem cells is the exosomes and the growth factors. The stem cells are gone. They're out of your body in a day or two. But the message gives you benefits that last weeks, months, if not some of them permanent. Why? Because you got that cell signal. So the stem cell is the delivery mechanism. Here in the States, we call that the Amazon truck. And then the exosome is the package. You want that package to your front door, it's the exosome. And so we can now skip the stem cells, go right to the stem cell exosomes. And we like that. They travel through tissue better. They are more abundant and less expensive. That's a good one. They cross the blood-brain barrier because they're 1,000 times smaller than a cell. Cells are measured in microns, where exosomes are measured in nanometers, and we call them sometimes nanoparticles or nanomedicine. So they'll cross the blood-brain barrier. They cross the placenta. Pregnant women have what? They have growing hair and glowing skin. Why? Because the mother's getting a daily dose of regenerative medicine. She's getting stem cell derived exosomes. She's not getting stem cells. Stem cells do not cross the placenta, and you don't want them to, because remember, half of them are genetically foreign, and you don't want the mother to reject the baby. So exosomes are really how stem cells work. But we use the phrase stem cells because everyone's heard of it. That's the buzz phrase. But the best of stem cell medicine comes through the combination of stem cell derived peptides, proteins, growth factors, small molecules. You heard the word peptides again, and stem cell derived exosomes.
Amazing. Well, and the fact that they cross the blood-brain barrier means that they can reach any cell in the body.
Correct.
Right?
Correct.
Yeah. So what does that mean? Tell me what that would mean for enhancing cognitive function.
Well, we do use them for that. So the delivery mechanism, it can be intravenous, IV.
Okay.
But we have found that a nasal spray is easier and maybe more effective. And I have a gentleman that comes in our office every 2 months. He has very advanced Parkinson's disease. He shuffles in. He has no facial expressions, and he's on a lot of medicines for Parkinson's. and he plunks himself down. We do the nasal spray, and in front of us, within minutes, he has an improved use of his limbs. He has a bigger stride. He has a smile. He changes in front of us. And I really need to video it next time. So simple nasal spray. We spray a dose until it's exhausted, and then he's improved for up to 2 months at a time, and he can reduce his use of medicine. And people with brain injury use the nasal spray to come in for that. People with recovery from stroke have used it. We see improvements in cognition. Sometimes we pair that with a Selenc or a Cimax or a Dihexa or KPV or cerebrolysin or one of the peptides, because we want to extend the benefit from those stem cell derived exosomes. And that nasal spray in our office is only $700 US. So it's not crazy, amounts of, and honestly, we have IVs that cost, many thousands of dollars. Mm-hmm. I think the nasal spray at that $700 price point is probably better.
Great. Yeah, absolutely. Absolutely. And let's talk about, so there are some products that you've created as well, right?
We have created, we're going to go a little bit different direction now. I stumbled upon something in my reading, because I've kind of become the exosome guy. When I got into regenerative medicine 8 years ago, exosomes were just becoming available. And I said, what's the best way to do this? The exosomes are better and less expensive. Mm-hmm. And they're doing the work of the stem cells. We're finally skipping the middleman. So I became the exosome guy quickly. And when I go and lecture and stuff, it's usually exosomes, peptides, cell signaling. I stumbled on the concept that plants make exosomes. By the way, mm-hmm. all life forms make exosomes. I know you've had people on that covered the health benefits of adaptogens and mushrooms. We haven't even looked into that yet, but they do make exosomes. But plants deliver something very vital and beneficial to our bodies called phytonutrients. Mm-hmm. And they do so, the vast majority of those phytonutrients are encapsulated in, guess what? Plant exosomes. So we have come up with the first product, at least that I'm aware of, for oral consumption, and it's a nutraceutical. We sourced organic Italian fruits from the Mediterranean Blue Zone, from longevity, people that live to be 100. We looked at citrus fruits. We looked at mango, papaya, various things. And we created a blend. In that blend, we have finally found a lab that can extract the exosomes. So we created an anti-aging daily capsule, and it delivers that single, and it's a small capsule, delivers 4,500 times to your cell the amount of the phytonutrients like quercetin, fisetin, resveratrol, the type of things you would buy a supplement for or take a bunch of bottles, now are all in one capsule at 4,500 times the delivery you used to get. And these in the preclinical study show, guess what? Cellular longevity benefits, reduce reactive oxygen species, increase sirtuin-1 gene activity, which is a mitochondrial gene known for its longevity, right? It's a longevity one. A bunch of other improved markers, reduced cellular stress, reduced inflammatory damage of the cell. So we know this is a longevity supplement. And it can replace a whole list of things you might be taking. Most of the B vitamins are in these exosomes, everything but B12. B12 is not exosomal. Vitamin C. Now you can always take extra for different reasons, but there's plenty of vitamin C. And it's cellular delivery we're looking at here. If you take a supplement that is either created in a lab or extracted from plants, it's been through solvents, it's been leached out of the exosome. And if you take it, you lose some in digestion, you lose some when it gets into the bloodstream, and it bounces around. How do you even know it gets into the cell? When you get a B vitamin measurement in your bloodstream, that's not an intracellular measurement. That's just what's floating around in your bloodstream. That doesn't mean it's helping you or not. So we know that the cellular markers improve, so it's getting into your cell if it's exosomal, and that's where we did the studies to figure out it's 4,500 times better in cellular delivery. Now, some people have figured out, oh, we can take these supplements that have been extracted out and we can put a liposome on them and it gets better delivery. And they're right, but it's still the exosome, nature's liposome, is 700 times better than the liposomal delivery. So liposome delivery is great, but nothing beats nature. So the exosomal delivery in our first product, which we called longevity exosomes, is great, and people report improved hair growth, nails, skin is better, more energy, and this is just the beginning. It's just our first product. We're looking at other types of fruits and plants, getting the exosomes, because there's no better way to deliver. And you couldn't eat enough fruit to get what's in that capsule, right? You would have so much sugar and so much volume, you just couldn't do it in a day. So this is really the next quantum step in nutraceuticals and phytonutraceuticals.
Yep.
Is this. And as far as we know, it's the only regenerative exosome, the only regenerative thing on the market, the only exosome on the market that can do this.
That's amazing.
Yeah.
That's definitely the first one I've heard of. So I think that you're right.
Thank you.
Super interesting. And when you talked about people and the natural consumption,
yeah,
right? You just can't. You couldn't consume enough.
Yeah.
To get that, it would be physically impossible.
Yeah.
So I think if you're really digging into that underlying health support, you have to look at things like this, because you won't get it any other way.
Yeah, and I know you're active in functional medicine, Lisa, and to become a better medical doctor, I'm actually in the middle of my functional medical training. So we were just doing a set of lectures on the immune system and the importance of phytonutrients in regulating, the innate immunity and adaptive immunity, and how things get out of whack and become autoimmune or hyperinflamed or whatever. And I'm thinking, wow, phytonutrients, we've evolved around these plants. They are so important to our health. We're tapping back into ancient medicine, right? Eastern and Ayurvedic, and those folks knew what plants and herbs were beneficial. They didn't know why. Now we know why at the cellular level, where certain phytonutrients work. And so I feel like blessed or lucky that we were able to figure out how to deliver phytonutrients at a significantly beneficial level to the cell. That's important, not just to your bloodstream, to the cell where it gets. So those exosomes go, remember, endocytosis, right into your cell, deliver those phytonutrients where they can do the most benefit.
Yeah. No, absolutely. Well, and super interesting too. I think that what you have discovered is going to be a huge part of that next generation of not only regenerative, but also functional medicine or longevity medicine. It's inevitable.
I don't want to take credit for discovering anything. There is incredible amount of science. If you look up plant-derived exosome, or they call them plant-derived extracellular vesicle, which you'll see a lot of that PDEV out there. They're being used in disease, in cancer. So these aren't claims I'm making, everyone, because I'm not allowed to make claims. I have a nutraceutical, but there's research on PubMed. I can share it with you if you want it. It's out there. Do your homework. I stumbled on this. I'm just the first guy that didn't give up and put together this nutraceutical. Yeah.
That's amazing.
Yeah.
That's amazing.
Thank you.
Wow. Well, and I think too, for people who, again, I feel like we're all looking for the next level to support anti-aging, right?
Yeah.
We're looking for that next thing that's going to be able to help. And, I feel like sometimes people think it's one thing. And I think that's a mistake, because I feel like there's sometimes a strategic strategy on what can be used moving forward and what's going to resonate and support you, because we're all different as well.
I agree. A longevity if you want to live long and healthy, health span,
Mm-hmm.
healthy longevity,
Mm-hmm.
you have to have a plan. You have to carry it out. And the earlier you start and the more you do, the better, right? And this is, again, back to the basics: diet, exercise, sleep,
Yes.
hormesis. Got to do your hormesis, right? Slight stress on the cells to build adaptability, resilience.
Yep.
Maybe it's the right amount of supplements to,
Mm-hmm.
because our diet just doesn't have everything it needs. And then, maybe it's regenerative medicine. Maybe you want to treat yourself to an annual or every 6 month exosome intravenous. I do it
Mm-hmm.
every 3 months, but I have it right here in my office. My nurse just hooks me up and I do it as a preventative.
Yeah.
We do have people that do that.
And what do you suggest? Like from optimal to, you know, what would be acceptable? What would that be?
I love to
What?
look at data. I want to see some
Yeah.
labs,
Yeah.
inflammatory markers,
Mm-hmm.
maybe a biological age test, maybe we do one of
Mm.
those. And
Yep.
then I love to see your health metrics. Are you wearing, a Whoop band, an Apple Watch, a Garmin, something like that, where we can look
Mm-hmm.
at your HRV. I have young, healthy people that like to try the exosomes. They come in, I didn't feel a boost in energy or anything, but I'm pretty active and young. But my
Mm-hmm.
HRV went up 50% without changing anything else,
Wow.
which is big, right?
That's
So
huge.
we know it's helping at the cellular level. We
Yep.
know that.
That's amazing.
Yeah.
Wow. On the cut, you know what? The world of functional medicine, regenerative medicine is so exciting to me today versus even 5 years ago. There's so many amazing things coming to the surface.
Yeah.
Yeah.
I'm excited because I'm pushing that. Like I'm
Yep.
pushing peptide suppliers to get me a peptide they haven't heard about. I am
Yep.
pushing for next level exosomes. So we have now tissue specific exosomes that we're looking at. So
Interesting.
so exosomes, instead of a generic stem cell cargo, might have a specific cargo for hair regrowth, for skin,
Mm.
for brain health,
Yep.
neural stem cell derived exosomes. So we are getting more granular about that, which gets right back to the biochemistry, to the functional medicine is really applied biochemistry, and I love that because I get back to my roots,
Mm-hmm.
and because what happens you go through a medical school, they do have biochemistry, but then you quickly learn, all of these sort of macroscopic things on top of that, and you practice at the patient level, and you're really not doing as much biochemistry as you want to. Why? Big pharma's driving you. Just give this drug if the cholesterol is elevated, which now we're learning cholesterol might not be elevated when it's 230. So,
Yep.
you know, get back to the medicine before it was, influenced by policy, which is influenced by lobbyists, which is influenced by big companies, big
Mm-hmm.
pharma, big implants, stuff like that. So I
Yep.
love pulling away from that.
That's amazing. Amazing.
Hey,
Wow. Well, I am on board with all of it.
sign her up.
I love it. Sign me up. Oh my goodness. I always say it's interesting. You talked about the younger people benefiting from it just from their HRV increase.
Yeah.
And, when you're in your 20s, you can maybe get away from not practicing those really foundational lifestyle habits, right? That we know we have to do, right?
Yeah.
The good nutrition, the hydration, get your sleep,
Yep.
circadian
Yep.
rhythm, what have you. When you get into your 30s, it's a little more difficult. When you get into your 40s, it's a little more difficult. When you get into your 50s, it's a whole other ballgame, right? And I'm sure when I hit 60, I'll have a different thing to say, but I'm not there yet. But the body doesn't respond the same anymore. And if you want to be that kind of, high performance
Yep.
person thriving, you have to invest in some of these things
Yep.
to be able to stay at that level.
Well, I have reached 60. I can tell you you're right. And my sleep is probably the number one thing I must do. The exercise has to be strategic, right? You can't
Yep.
just go exercise. So I'm very, very conscious about how that happens. And because maintaining muscle mass and with it bone density, that's your longevity organs. If you keep moving, your body will have a will to live internally, not mentally, but internally. You have to move. We're based on that. So muscle mass is everything. And that I probably didn't mention hormone optimization enough in that, because if you're, especially women, because it's such a precipitous fall in hormones, if you do not look at that and consider strategically and safely bioidentically replacing that and optimizing that, you will lose your muscles and your bone density, and you will wither away. You need to be anabolic. As a colleague of mine just taught me how to phrase it. You need to be growing. If you're not growing, you're withering away like a raisin. So you have to be growing. That doesn't mean getting bigger, but you have to be laying down new muscle and new bone all the time.
Yep, absolutely. Absolutely. That's a great point. Wow. Well, that was great. I mean, we could talk about peptides for another day, right? There's just so many benefits. I mean, that's just one part of all of it.
Oh, yeah.
But I will tell you how to find and follow Recelebrate. So you can find them on Instagram, on TikTok. It's and then Cell. So CELL. Abrate, right? So make sure you spell it right. It'll be in the description. And yeah, I can't wait to hear about all the new things that are going to come out. I have a feeling we're going to be back here again in the near future talking about those.
Phone a friend anytime.
Love it. I love it. Well, thank you so much for joining me. This was wonderful.
Great being here. Thank you so much.
Absolutely. So for those of you watching on YouTube, thank you so much for tuning into this episode, and make sure you give it a thumbs up and subscribe to my channel. For those of you listening on your favorite podcast host, please know that we appreciate you being here. We hope you enjoyed this amazing information and episode, and I will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit Pitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Pitel-Killah.